If you are turning 65, you might be wondering, what actually happens if I miss my Medicare deadline? The thing that you hear the most when you're turning 65 and first becoming eligible for Medicare is that if you miss the deadline, you could be hit with late enrollment penalties that last for the rest of your life. But what is the truth, right? There's so many things that come to you, whether it be through mail, whether it be through unsolicited phone calls, which are illegal, but it still happens, and TV commercials, social media commercials, etc., that really kind of pump up and make this fear very real for a lot of people turning 65 about lifetime Medicare penalties. But what is the truth, right? What is the truth behind the smokescreen of all the propaganda? In this video, I'm going to talk specifically about everything you need to know if you miss your Medicare deadline. Hi, my name is Christian Brindle. I'm the founder and operator and CEO of Everything Senior Insurance, formerly known as Christian Brindle Insurance Services. And we specialize in working with folks on their Medicare health plans, whether it be Medicare Advantage plans, Medicare supplement plans, or Medicare prescription drug plans, amongst other types of health insurance products. We operate in about 45 states, and we work with thousands of clients across the country, okay? And we've seen plenty of situations where people maybe miss their Medicare deadline when they're turning 65, and they kind of get themselves into a tough situation. So let's first talk about it. When you first turn 65, for most folks, that is when you first become eligible for Medicare. Medicare is not eligible for anybody unless they are 65 years old or older, unless you meet certain criteria, right? If you are on Social Security disability for 24 months consecutively, you will be placed automatically on the 24th month on Medicare disability. It's no different than original Medicare at 65. It's just, they call it Medicare disability because it's just Medicare before 65, right? That's all it is. But outside of that type of scenario, the first time you're eligible for Medicare is if you turn 65. Now, the only reason you're eligible for Medicare and you can get Medicare Part A at no cost, no premium, is if you or your spouse, I should say, have worked in the country, the United States of America, for at least 10 years of your life and paid into FICA taxes. FICA taxes is Social Security and Medicare, okay? Now, when you turn 65, if you are working, you or your spouse are working, and you have insurance, credible coverage, typically 20 employees or more, and you have that credible coverage through your employer, right? It has to be the same thing. I see people all the time that they're turning 65, they are becoming eligible for Medicare, they have insurance, but it's not through their work. It doesn't count, right? It has to be active insurance through an active employer that has 20 or more employees, and it's considered credible coverage. You're able to postpone taking Medicare and not take it at 65 without any late enrollment penalties or punishments. But let's say that's not you. Let's say that you don't have that credible coverage and you just totally forget, right? And you just don't enroll on time. Well, what happens? Well, there's certain time periods that you can enroll into Medicare. And the three time periods that you have is, number one, you're turning 65. That's considered your open enrollment window. The second is a special enrollment period. An example to that is if, let's say, you postponed your Medicare due to work insurance, like I mentioned a second ago, and you're coming off of that work insurance, you're retiring, that's considered a special enrollment period, and you're getting onto it, let's say, 67, 68, 69, whenever it is that you stop working and retire. That's considered a special enrollment period. The other enrollment period is known as the yearly general election period, also known as the GEP. Now, the GEP only happens from January 1st through March 31st. And when you sign up for Medicare during the GEP, if you missed other enrollment windows that you could get on, your Medicare typically starts the first of the upcoming month, your Medicare Part B, I should say. And that's when you can enroll into a Medicare supplement or a Medicare Advantage plan to go with your Medicare to kind of make sure that you have the full layer of coverage that you need, because Medicare by itself does not provide enough coverage. We've talked about that extensively on this channel. Make sure to check out a video if you want to know the details in terms of why. But that being said, let me paint a picture for you, right? Let's say you turn 65 in April of this year, 2025, and you just don't get on Medicare. You just drop the ball, right? You don't go to the doctor a lot. You don't feel like you need it. Sure. Let's say 2 years go by. We're now in, let's say, April of 2027. And you decide, I want to get on Medicare. You're starting to have more health problems. You need the insurance, right? You need the coverage. Well, at that point, you go to enroll into Medicare and you're told, sorry, you're outside of your open enrollment window and you don't qualify for a special enrollment period because you're not coming off of work insurance. You cannot get onto Medicare except for during the GEP, the general enrollment period. You have to wait until January of the next following year. In this scenario, it'd be January 2028, right? We're in April 2027 in this hypothetical. So you have to wait till January of 2028 to get on. So that sucks, right? Pardon my French. Because you have to wait almost a year, just a little shy of, to get on Medicare and get any coverage. Most other insurances will not allow you to get onto them when you qualify for Medicare, by the way. So you're really backed into a corner. It's Medicare or bust. So not only do you go this period of time without the coverage if you need it, you are also getting penalized, late enrollment penalties tacked on for Medicare Part B and Medicare Part D, as in drugs. What this means is you have late enrollment penalties that for each month you go without it, it grows a little bit, it compounds on Medicare Part B and drug coverage. And on both sides, you sign up for Medicare Part B and you have this compounding penalty. And the longer you go without it, the bigger it becomes. And it goes on top of your Medicare Part B premium. And it's that much more for the rest of your life. It will never go away. And there is nothing you can do to get it taken off. They don't care who you are. They don't care how important you are. They don't care your circumstance. They don't care why you didn't get on. You're going to be punished forever. And that is the truth. So Medicare Part B, the standard premium in 2025 is $185 per month. If you're in a higher tax bracket, you can pay more for Medicare Part B premium. Or if you're in a lower tax bracket, a very low tax bracket like food stamps tax bracket, Medicaid, your state, I should say, will pay for your Medicare Part B premium for you in certain circumstances. But outside of those two extremes, very low income or very high income, typically everyone pays the same Medicare Part B premium, which is $185 a year. Most people have it come out of their Social Security, and a lot of people don't even realize it's coming out. It's out of sight, out of mind. They think they're not paying anything for Medicare, but I assure you they are. So that late enrollment penalty is tacked on to the Medicare Part B premium. Let's say it's an extra $20 a month. It will be an extra $20 a month forever for the rest of your life. That is your punishment for not getting onto Medicare at the right time. On the Medicare Part D, as in drug side, you sign up for a credible Medicare prescription drug plan, either through a Medicare Advantage plan, or if you go with a Medicare supplement, you pick up a standalone prescription drug plan. And let's say the cost of your plan is $10 a month, hypothetically. If you have a late enrollment penalty on that, they tack that onto your premium as well. And it's that much more for the rest of your life as well. So they get you on both fronts, Part B and Part D, as in drugs. And it's that much more for the rest of your life. If they decide to raise your Medicare Part D premium on your plan, it raises, but your penalty, it stays. It doesn't go. So let's say you're paying $10 a month. You have a $20 penalty, hypothetically. You're paying $30 a month. They decide to raise your plan premium next year from $10 to $20. Your $20 penalty does not come off. So you're paying $30, you're going to $40 if they raise that $10 a month. It never goes away, and it follows you on any plan you could get with any insurance company. Your Medicare Part B, same story. If they decide to raise the Medicare Part B premium in 2026 from, let's say, $185 to $195, and you're paying an extra $20 a month, that extra $20 a month stays and the increase happens, right? So these penalties will go for the rest of your life. It is a very good idea to make sure that you don't miss your Medicare enrollment window. It's not a good scenario. You might be put in a situation where you can't get on until certain times of the year, like I mentioned, the general enrollment period. And the longer you go without it, the bigger your lifetime penalties become. So we highly recommend getting on at the right time. Again, most people don't tell you this. If you're working and you have credible coverage through your employer, 20 or more employees, and it's an active work insurance plan through an active employer that you're actively employed on, either you or your spouse, you do have the ability to postpone Medicare and not take it at 65 with no penalties or punishments. That's the one exception. So I hope this video was helpful. I hope you found it educational. And if you did, please do us a favor. Smash that like button for the YouTube algorithm. It helps more people turning 65 find this information who desperately need to hear it to avoid them making mistakes when they turn 65. And if you did enjoy this video and you want to see more like it, subscribe. Comment your thoughts on this video down below. Also, put down comments on videos you'd like to see us address in the future. We'd be happy to answer any questions that you have. Again, if you'd like to work with my agency on your Medicare health plan, we have no cost for our services. The only thing is you just have to get your plan through us, and we offer you lifetime service on your plan. Again, we work with 45 states, so most of you watching, we should be able to help you with. Work with a multitude of different insurance companies, so we specialize in helping you look through the options and find the best plan based on your needs and preferences. Our office number is 801-255-5340. Brindle Insurance Services. I'm Christian Brindle. Thanks for watching. Happy Medicare, everybody.